how psychiatry gets a bad name. So a patient who is in a state hospital, for those of you who don't know, state hospitals are state-funded inpatient psychiatric facilities. That means that the patient lives there, often for months and sometimes even years. So these hospitals are generally going to have patients who are severely mentally ill, may have had multiple inpatient hospitalizations in the community, and not able to be stabilized, let's say with maybe a week or two in the hospital and then going back to their outpatient. So they really need a longer period to be stabilized. Those are typically the patients you see in these facilities. And it's just almost, like I said, it's almost impossible to believe that somebody could be in seclusion for 600 days. In my experience, typically seclusion is used for individuals who are displaying violent, threatening behavior, and they need to be basically taken out of what we call the milieu, the area, the clinical area, for a while to basically kind of calm down and de-escalate. So seclusion means that a patient is involuntarily placed in a room or an area and they're not allowed to leave. So if a patient decides on their own they want to take a time out, maybe they're feeling agitated or just want to take a break, they can go to their room or to an area themselves. And as long as they're able to leave that area on their own, that's not considered to be a seclusion. But this individual was in a room where he could not leave. And, clearly there were people in the hospital who did not agree with this, because someone snuck him a cell phone. And he was able to record some of his experiences and put them on YouTube. And I looked recently and it was still uploaded to YouTube. So you can, definitely check that out. But we know that secluding people for long periods of time is not good for mental health. And just so you know, a seclusion room is not like the typical room a patient like this would have, where they would have, their own belongings and be allowed to wear, typically regular clothes. When people are in seclusion, it's basically a blank room. There's very little in there. And typically the patient is wearing scrubs or some kind of protective clothing so they cannot harm themselves while they're in there. So it's not a very nice place to be for, hours, let alone days. Again, I know we're from the outside looking in, but it really is hard to understand how this happened for such a long period of time. And if you have people in your family, if you have friends who are severely mentally ill and they are in psychiatric facilities, please check on them.